Good morning, good afternoon, good evening. It depends on when you're listening. Welcome to The Solution. Nothing changes if we change nothing. Hey, Chevar.
Hey Ronnie, how's it going? The sun is out, the birds aren't chirping, but it's still beautiful out.
The sun is out now. It was kind of cloudy this morning, but we've gotten past that. I hope that's an indication of the way life goes.
Absolutely, absolutely. My son started his first day of in-person class this week. I'm a little bit skeptical of setting him in. He came home, but I'm still teetering towards doing just the home, just having him stay home and just working from home. I'm concerned about, like you said, life and stuff. We always talk about life and stuff. So I'm trying to practice prevention from COVID, so to speak.
How does he feel about it?
Uh, he, I think one of the things where for him, just probably happy to go outside and see people.
Mm,
I think that was probably and it's new. These are new people, so just happy being out amongst teens his age, And there were only 7 kids in the class because they have to social distance.
right.
When most kids are at home, and he was telling me they were 6 feet apart and they had to do group work. What they did it via Zoom at different desks or computers.
Okay.
So they were broken into groups, but they weren't in groups. They were in groups via Zoom in breakout rooms.
Well, that's creative.
Yeah, very much so. So yeah, another way to use Zoom, but in person.
Bottom line is we're inventing this as we go along. Because we've never had it happen before, so every day is going to be a new adventure. Here we are. When we first started doing the podcast, what was it, like April? I think,
Yeah, yeah.
that was 6 months ago. And we figured, oh, we'll be doing this for a few months, but it doesn't look like anything's changing anytime soon here in the city.
No, absolutely. I mean, the only thing that's changed for the city is the indoor dining at 25%. Uh, Buses are packed actually, with you have to pay to get on now. Well, because more people are at work, more people are out and about. Like the traffic is, I'm near Fifth Avenue, so this traffic is busy over here. It's
Mm-hmm.
really, really busy, like really, really busy over here. So, I mean, people are adjusting. I'm not sure how happy they are about it,
Right.
but people are adjusting because they have no choice, and yeah, I mean, I think about the restaurants and they have to make money, but also think about the patrons and going in these restaurants. So you have to be careful because you don't know who around you may have been exposed to,
Mm-hmm.
or is it, or has it. And this isn't pointing at anyone or saying close restaurants. We just have to be mindful of those things.
Yeah, well, you can't eat with a mask, so you got to take the mask off.
Yeah. I mean, it's going to be interesting. I'm just curious to see how bathrooms work in restaurants now, indoor bathrooms,
Mm.
because you can control the seating, but you can't control how many people go into the bathroom in proximity there.
Mm-hmm. Well, I guess that they have to be mindful of that. Maybe keep an eye on how many patrons are allowed in the bathroom at the same time.
I'm not even sure people even thought of that.
They need to. Look,
I don't,
I had it. I was out shopping one day, and the dreaded thing happened where I did have to use a restroom, and I thought, what am I going to do? What am I going to do? And I said, you know what? I'm going to use the family room because I was the only one in there.
yes, the family room is just for the family.
Right. So
Yes.
I used that. I was still a little freaked out. Went in with extra gloves, extra hand sanitizer, and just made it work. It's harder for women, but we deal. You know. But it was like traumatic at first. I thought, how am I going to do this? But I found a way. It's amazing how our fears will take us one place, and then all of a sudden, the solution
The
takes us to
solution.
another. We change what we're doing. We change the approach.
And I do want to say that that's a great title for the show, The Solution. In your analogy just now, talking about solutions is great. And when we're doing the work that we do in prevention, we always have to think about solutions. Not just the problem, but how do we resolve those? I mean, what's the resolute to the problem, or issue at hand? How do we support young people or people in general who maybe on the cusp of using, and what do we do to prevent them? What's this, how do we move them into a different direction? Whether it's talking about starting your own podcast, and
Why
that was a
not?
solution for us to keep
Yeah.
busy.
And I think the thing that I'm hearing from what you're saying is that it's not always the same. A lot of people get into that thing in the prevention field a lot, where they do the same program, the same techniques, the same strategies year after year after year. But we have to change as years pass by, months go by, as kids change, as parents change, as life changes. We have to be an ongoing fluid science. We cannot do it the same all the time. Even the evidence-based programs, they have to be adapted to the populations they serve. And I think people forget that because they get comfortable. And with comfort comes complacency.
Absolutely, absolutely. Yeah. But I don't know. Right now, I don't think people should feel comfortable where they are, what they're doing, because we're in foreign territory. Granted, like you said, it's 6 months, but it's still foreign. We're still trying to figure out. We want to go back to what we consider the normal.
Right. Will that be ever again, though?
You want an honest answer from me? I don't want it to be that again. For a variety of reasons, I'm not the biggest fan of crowds, although I love concerts, what have you. I like my personal space. I mean, this is a gift and a curse for me. Gift for me. I get to wherever I go. If I do go somewhere, I have the right to say, "Hey, this is my bubble," and the person, they can't. Oh, you're right. I shouldn't be this close to you. So even going into the supermarket and having the aisle to myself. For me, I mean, I don't know. I can't speak for everyone else.
I like it too.
I just say, for me, it's good. Getting on, if I do get on public transit, having a row of seats to myself for an area, it's because like that normal of being on top of each other like sardines, felt like packed like a sardines, where whether it was a concert or a restaurant or a movie, now I have my space. Which that's a normal that I would want. But I do understand most of these things I'm referring to is a business. And they got to make their money.
Yeah, and we have the choice whether we go there or not during those times. But it's funny how traditions are going to change. I mean, I like going to, like the big warehouse places to get, I stock up.
Right.
And what do I miss the most? The samples. They'll never be again in my lifetime. I'm like, wait a minute, where are my free samples that I love?
You know what? You're right. Hold on. You are so right. I haven't seen samples in any of the warehouses since then.
And I always love buffets. Right. Yeah. No more buffets. What about birthday cakes? I mean, think about it. How many years have we been eating cake that people blew all over?
Oh my God! Let me tell a funny story. So when I was younger, birthday parties, what have you, and I would go to birthday parties or someone come to my birthday party. I never blew someone's candles out during their birthday, just because I know spit flew everywhere. I would hate when, make your wish, Chevar, and then you blow and your cousin blows and his or her spit goes everywhere. I didn't want to eat the cake anymore. I'm like, nah, I'm good. My mother like, boy, eat this cake. You know how much I paid for this cake? I'm like, no, you shouldn't. You should have. Nope. You shouldn't let him blow on the cake. Like, it's my wish, my cake. Let me blow. And leave me alone. But yeah, so that part, I don't miss the blowing of the candles part at all.
But even the individual blowing on their cake, you're still going to be having something someone spit on.
That's true. That is true. I didn't think of my own spit, but I just thought about when I blew. I was very careful, so I'm gonna blow into the microphone. So I try to be as careful as possible because in my mind, I'm like you said, I didn't want anyone to have I didn't want your spit. So I know you didn't want my spit, but you have this overzealous family member who speedboats the whole cake.
See, a lot of things are going to change. I mean, we go up to Albany, which we will again, stay in the hotel we stay in. How are we going to eat breakfast? I think of things like that. Like, wait a minute. So, hey, you know what? These are the minor things that change. But, and again, I'll just, tell our viewers, if you see me turning around, it's because one of my dogs is doing her thing. and I have to make sure she stops because it's usually destructive to her. One of my dogs has been really sick, but we got great news yesterday that her liver values, which had been off the charts, with treatment and diet, they've gone way down and in the normal range again. We thought this was it. So I'm very excited. You know, sometimes we don't realize how important things are, and that we just need to have a little faith. Oh, somebody's at the door.
This time it wasn't me.
And I'd finish my thought.
This time it wasn't me. I didn't get interrupted this time. So cool.
Well, hello.
Hey, how are you? So our guest today is Marinez Rodriguez from FSBC for South Bronx.
Well, why don't we let her do a little intro and tell about what she does?
Absolutely, go for it.
I am the project coordinator of South Bronx Coalition, and we're just a community coalition of different diverse community partnerships, all with the same mission of reducing underage drinking, marijuana, and other substance misuse. We cover specific zip codes, even though we're technically working on things in the South Bronx, which are 10455, 10459, and 10474, the Hunts Point Longwood sections of the South Bronx. That's me.
And that's a lot of territory. You know, it's funny, I grew up in the projects in the Bronx until I was about 6, and my grandma lived in the South Bronx. So that area, whenever I go to the coalition meetings, I feel like I'm in familiar territory. And I know that's an area that's really needed prevention. So during this time of lockdown, pandemic, and going back, I mean, how has the work changed for you? Like, how have you kept up with prevention?
So we know that, according to science, right, that during catastrophes and crisis, the rate of alcohol use goes up. So knowing that and making sure that we raise awareness around that, and we look at examples of what has worked in the past and apply it to the restrictions that we have now, and how do we bridge the gap between those two, we figured that prevention was needed from the beginning, right? We didn't know how long this lockdown would last, but we started to take preventative measures of, let's start raising awareness and making sure that this is paid attention to. So we started reaching out to local representatives and saying, hey, this is what the research says about certain crises and catastrophes that happen. And these are the statistics around drug use, including alcohol, marijuana, and opioid use that rises. And with that being, we decided to start just making sure that our partners had resources around how to help prevent these issues and how to react when it's already existing. And we started to do campaigns. We had already had an existing campaign of a video that consisted of community partners and youth, as well as parents that help us in our efforts through volunteer work. And then we decided to partner up with you guys to do the NYC Pop campaign that brought not just our efforts out onto the table, but the community-based efforts. So different New York City coalitions with one mission, helping to spread the same message. And that's been pretty helpful, and it's expanded, as you guys know. Something else that we've done with prevention is tackle gambling amongst youth. So we also know that gambling is connected to substance use. And being that there's less outdoor activities, less social interaction, what are youth gonna do, right? There's not even summer youth. So they're gonna find creative ways to entertain themselves. And unfortunately, this includes gambling. And this is betting anywhere from on a video game through to card games. An innocent game of Uno could become gambling. And just raising awareness around that and educating people has been something that we've been trying to do via Zoom, via social media, and through email. I was very long-winded.
Yeah, no, not at all. No, I mean, there's so much, because we were just talking earlier, just how everything's changed during this. I mean, we were laughing about stuff like, yeah, that's the last time I'll eat a piece of cake that somebody blew on. You know, and you know, have buffets and my snacks at like BJ's, but or Sam's Club, but the work has definitely taken a new type of path, you know, so to speak, and we've seen use go up, you know, and young people being home, some of them without parents at home. They have a lot more space and freedom to do it. In some cases, in other cases, the parents are there, so they don't have as much leeway. So but gambling is something that they can do very quietly and online, without anybody noticing.
And also something that came up was the fact that a lot of times when parents drink socially, it's not necessarily around their children. They have a night out, they get a babysitter. But now in close quarters, parents are drinking in front of their kids. You know, there's Zoom happy hours, not only with coworkers, but with family members, with friends. That's been a very popular thing. And paying attention to how kids view that and how they model their parents' behaviors and how this is influencing them. And, you know, media itself is always like, hey, you know, had a hard day, having a hard time, let's have a drink, let's have a drink. And children are now witnessing their parents' coping mechanisms and what they use to help make themselves feel better. And of course, whether it's conscious or subconscious, the kids are gonna intake that information. And hopefully, you know, with the awareness that we're raising, parents are thinking, hey, maybe I should have a conversation with my child, and what can I do to counteract this? Because parents get to live their life too. We're not saying like, hey, don't do anything around your kids, don't live your own life, but just, you know, raising awareness that there is influence and your behavior does have an impact. As you guys know, a lot of our work is evidence-based, and one of the biggest pieces of evidence that we use through science is the fact that kids have admitted in independent studies that what my parents say to me does matter to me. And it actually matters more than what my peers say. And most parents would think, hey, forget that. Like, my kids aren't going to listen to me. I can say what I want, but at the end of the day, kids are going to be kids. But actually, they might do what they end up doing regardless, but having you speak to them does have a huge impact. So we're just trying to raise awareness. And luckily, social media has actually brought different partnerships to the table, because being that there's not as much in-person interaction, there's more of an effort of like, hey, let's try to reach out to different people and even businesses. It's much easier to tell a business, hey, listen, because right now there's a lot of alcohol delivery and there's a lot of takeout. Make sure that you're IDing, make sure that you're, now that alcohol to go has been a lot more simpler, make sure that you're like being accountable for what you're giving out to your clientele. So in doing that, we've kind of made more partnerships with local businesses and with other resources. And that's been actually really great. And more attendance at meetings due to the fact that it's easier through Zoom.
I do want to bring up something you mentioned earlier about communication and how important communication is with an adult and a young person, because that is prevention. You know, and I'm gonna tell a quick story. I used to, prior to this work, I was a program director. Hopefully the story is quick. I was a program director, and I remember some tragedy happened at work where, you know, where it put me in a funk, and I was running a middle school program at the time, and you know, and I came down to the lunchroom, and the kids were running wild, the staff weren't doing what I expect them to do, and I saw the student sit in the back by herself. So instead of me going over to the staff to address the staff, you know, don't do your job, didn't do that. What I did was I walked over to the young person, I sat across from her, and I said, "How was your day?" And she had this perplexed look on her face, and I said it again, "How was your day?" She says, "What do you mean?" I said, "How was your day?" She said to me, and I remember these words, "No one has ever asked me that question." And I'm like, and in my mind, I'm like, wow. And knowing her family, and it speaks to what you said about, you know, and I don't want to put her business out there. There was some substance abuse in the family. So I did know her background in the past, and I didn't take that in consideration where she wanted someone to talk to. And we spoke, and I didn't ask her why was she sitting by herself or what was wrong. I said, "How was your day?" And eventually, you know, to speed the story up, she did come to me and say, "This is what was bothering me right now. This is what I'm going through. But thank you for asking me about my day." And after that day, every morning, she would come to my office to make sure I was at work. Every single morning. And I mean, she's a young adult now, but I still speak to her via Instagram. She's a chef now, pretty dope. So her saying to me, like, you are the person to help influence me, that there are adults out there that care. You are the prevention tool in my life. She didn't say that word, but that's what I was. And similar to what you're saying, you know, speaking to your young people, the words you say are very powerful. When you put down your child, I read a lot of comics, and there's always abuse in comics. The villain that was abused by his dad or his mom, because they said mean things to him, and the superhero had all this praise, what have you, and even the praise sometimes kind of can mold you in a way. And it's like, and I bring it up because of empty praises, just saying you're good, but also explaining to young people what they're good at. You're good because of this. You're great because of that. But, you know, giving more substance to behind why this person is good. Because a lot of times when someone tells you they're bad, they can pinpoint every single thing that's bad about you. And when you say they're good, tell me why I'm good. Tell me why I'm great. So to bring it back to what you were saying earlier, the conversation is important, and that's a key role in prevention, is having those positive conversations and giving substance behind those positive affirmations to young people. Like you were going to say something, Ronnie.
No, I've just been thinking about the whole thing about parents too, and what you're saying. What a great opportunity this is, or has been for you, about parents. And it's true. I didn't even think of that, how parents are definitely, they're home and their kids are seeing them for who they really are in many ways, probably maybe for the first time. Because a lot of that behavior was often done outside the house. And it comes into, like, you know, what do we need to do with young people? One thing we do is model. You know, if we don't model certain behaviors, they don't get to see them. And which behaviors do you want your kids to see and model? So, but then there's that whole dilemma. I'm an adult. I need to be able to do what I need to do. So those conversations become really crucial. But yeah, I mean, parents, a lot of them are the ones who are bringing up that by that 30% that we're seeing, because they're home, it's depressing. This is having a real effect on mental health. I mean, I think each one of us, we've had conversations with each other about this, how tough it is on some days to kind of just get your energy going, especially what's been going on lately. That's why NYC Pop's been such a great outlet for me, because we face the truth. We say, this is the way it is. Here are some good ideas on how you can change this. And I think that's so crucial. If we don't have these difficult conversations, we can't get past it. So I loved what you said about the parents, and I think that message is going to resonate with people who listen to this, because a lot of them probably don't even realize it's happening in their house.
Definitely.
No,
and I think that another thing that comes up when you discussed the story that happened at your job and with parents is that with my experience and my working with parents and working with youth, is that what needs to happen is that for every negative thing or correction that you give a child, you have to go above and beyond to find positive things. Mm-hmm. And I brought this even like to my friends and us that are parents, and telling them, like, you know, that when you do that, you have to find other things. And they're like, I'm not just gonna make up stuff. And I'm like, well, you can always find something positive. Like, hey, I'm so glad you put the toilet seat down. Like, just that. Or I love how you always finish your plate. Even if you just corrected them about eating too fast. Just finding something to go above and beyond when it comes to positive reinforcement. And that way, when you come with the correction and with the teachable moments, it's more receptive. The kids are more receptive. And also, something that came up with mental health is that right now, as adults, we're having a hard time, right? So imagine youth. They haven't, first of all, their brain hasn't even developed to the point where they can fully work through what's happening and make up solutions for themselves, let alone us, that we have fully developed brains. And then if you come in and you start introducing alcohol into that brain, they're going to have an even harder time. And that affects dopamine levels, which can affect mood, which affects high risk behaviors. So being that there's more alcohol consumption in the home, how supervised is this alcohol? How safe is it? How accessible is it? And that comes to pills too, because, you know, a lot of people are taking things for anxiety. You know, now it's harder to hide the vaping from the kids. That used to happen if parents are doing the e-cigarettes, the smoking. You know, it was a lot easier before when you could be outside or you could be more social and you wanted to use your illicit substances. Now, not only are you forced to use these substances in the home, but there's an increase sometimes in arguments and tension, arguments with parental couples, with father to child, child to mother, just all type of stuff. You know, a lot of families have come together for different reasons. Either they want more of a sense of community or people need to be taken care of. So now you're introducing different dynamics that may not have the same patterns. For example, if a parent and a young child have a specific dynamic, right? And what I'm seeing a lot, and I'm speaking anecdotally as well, is that a lot of parents now, they have better coping mechanisms when it comes to communication and socio-emotional skills than their elders. And what happens is that when you're bringing that elder in and old trauma patterns and triggers are coming up and your behavior is changing and the kid is seeing this, and there's just a lot going on that I think we tend to underestimate. That all goes into the socio-emotional health of the child, which will then affect the coping skills and their observing coping skills, not only in their parents, but in media. They're on social media, they're watching TV, and this is all going into their brain and their consciousness.
So, Marin, as I know you do a lot of you've done a lot of parent work with the groups in FSBC. Do you guys, well, I'm not sure if you have met with them during the pandemic. Like, have you guys come up with solutions or ideas how to use social media, how to stay at home? Because I mean, at home with my son, I have him reading the 7 Habits of a Highly Effective Teen, which is the first habit is be proactive. And what I do with him, I practice that with him to roll my, similar to what you're saying, like I have to give stuff up if I'm going to be a parent. That's me. I can't say that for any other parent, but for me, I've made sure to make a sacrifice for him that I want him to be the best version of himself. Not the best version of me, the best version of himself. So are there any things you're doing with the parents that you're working with? Or have you guys come with, or is there a plan to come up with a guide or a resource, or if you can share?
Yeah, so we've been trying to share a lot of what's actually been with Sesame Street. So Sesame Street has done a really good job at covering not only substance use. They have a Sesame character that literally has a mother that is suffering from substance use addiction, and also they've been good at covering the topic of race and systemic racism. So just sharing those resources, because parents are really at a loss of like, how do I communicate this? Because at this point, I have parents coming to me like, my child is telling me like, do you have any idea what Black people in this country go through? And they're like, my 9-year-old is saying this to me. And of course, and this is again a teachable moment of like, don't end up, people are always like, oh, I'm not going to talk to my kids about drinking. They don't drink. Well, that's the point of prevention, right? We want to have that conversation before it needs to happen. And personally, you know, I've done a lot of work with high school students that have used substances, and you want to ask them like, what was your first time? What was the age? It's like 3rd grade. It's like, I was 9, I was in 5th grade. And this is happening at a lot younger rates than people think it's happening. So that has been one of the strategies. Something that has also been coming up that I want to comment on is co-parenting. And I feel like, again, this is a great opportunity to talk about modeling. And we've been using the raising awareness to let people know like, hey, you're modeling. Hey, kids are influenced this way, right? Because what I have been hearing and what's been happening is that co-parenting around COVID, one parent might be more lax about like going out, wearing masks. So then the child is seeing this on FaceTime or on social media. Like literally 9-year-olds are like, Dad, I'm afraid to go with you because I feel like you go out in COVID and you don't always wear a mask, or you're out too much and I'm scared. And parents arguing about that or having tension and conflict, and kids observing that or feeling that. And that bringing up their stress levels higher. Like they will communicate like, oh, I'm so tired of my parents arguing. Or like, you know, they can't get away from each other anymore.
Exactly.
It's not like, hey, I'm gonna call you at work. You're at work and you're home in the next room. And this is New York City. We don't have these big houses. Some of us are forced to have like these little apartments that you just have no privacy. And even if you go to the bathroom, if you're lucky enough to have that ventilator that makes noise, there's still a risk of your child hearing what you're talking about. And it's going to affect the stress level in the home, not only of the child hearing, but of the parent knowing that the child is hearing.
Right, challenging times.
It's very, very challenging. And I don't have children myself, and I can't imagine. Like, responsible parenting right now is, to me, the hardest job in the world.
No, definitely, because I'm a parent, and in finding ways to keep your child occupied, finding ways to appease and make that your child happy, feeding, because food is now more expensive because they're home, and then they're literally eating you out of house and home because they're there. Being that role model, not like watching different television shows, talking about social justice, it's a lot. It's different because before, as a parent, you would only see your child before, when they wake up in the morning. And then when you come home from work, they eat dinner and they go to bed, and you have 2 days in the weekend. Now,
Right.
it's set, which I love being a parent. Trust me, I love being a parent. 7 days a week, I don't get annoyed by my son. Like, I love, like, he comes and he tackles me, hits me with a pillow and runs off. I love it. And he knows I love it. But that's not everyone. Not everyone has that ability to, they want, like you said, they want their space. I'm a dad who doesn't mind my son sitting next to me asking me, what are you talking about? Like earlier today, Ronnie and I were laughing, and he comes in, I'm like, Mike, he's supposed to be in class, virtual learning. He goes, what are you guys laughing at? I'm like, go back to class. And he's in a room next to me, and then he comes and we tell him, he goes, you have like really weird sense of humor. And he walks off. But that's important. Like, whether it's co-parenting or living with someone, how do you navigate the maneuver, and that's where the mental health issues come in. Like, how are we dealing with the stress? You said the stress levels come in. Like, what does that look like? The thing, we've never dealt with anything like this in our lives. We always say, right, I'm mad, I'm going to go to the bar, I'm going to go to my friend's house, I'm going to go play some basketball, I'm going to the gym. No, you're not. You can go to the next room next door to the bathroom.
That's no longer, an option. But, as you guys are just describing it, I got this picture. This is so weird. It's New York City, but of like Little House on the Prairie. It's kind of like the urban version. You're in there for everything, for meals, for school, for, for everything, entertainment. Every facet of life has now been confined to four walls. I live in a house on Long Island. We rented 676 square feet. It's a tiny house, literally one of those tiny houses. And we're literally on top of each other. So I've had to be creative in my space. Sometimes I'll go into the bedroom, close the door, and pull out my guitar. Or I put in my headphones. It's important to take those little times, those little moments for yourself, where you nurture yourself, even if it means just putting on some headphones and listening to music you love, closing the door and doing a podcast. There's different things to do. So sometimes we forget that, but that's what it made me think of, like 200 years ago, where everything was in one place. We're doing it now, but in an urban or suburban environment. We've got to get creative with it. We've got a lot more ways to communicate with the world than they did then.
Everything you're saying. And speaking of self-care, I think right now, with people of color feeling like all this trauma that's so in their face, and being on social media, and just one of my favorite quotes is from Audre Lorde, and it's, caring for myself is not self-indulgence. It's actually self-preservation, and that's an act of political warfare. And the fact that caring for yourself is not just like a luxury, it's a necessity in times like this. And whatever that means to you, to some people it's just a pedicure, to some people it's 5 minutes of breath work, and to some people it's a prayer, to some people it's a phone call where they can talk to somebody without necessarily having the person give feedback. And having those conversations of like, hey, can you hold space for me? I'm not looking for advice. I'm not looking for someone to criticize what I'm thinking. I just need someone to listen to me. And throw that in with financial insecurity, all that we're talking about, and unemployment, and not knowing what's going to happen financially, not knowing if you're going to be homeless or not. And all of those increasing risk factors for substance use. And people using more opioids and painkillers during these times? And are these being safely put away? Are they being safely disposed of? You know, we have an initiative where we're providing free disposals for medication. You know, we're trying our best to meet the needs that are arising and to get ahead of them, right? Because during the pandemic, unfortunately, when we get out on the other side of this, there's going to be a lot higher rates of misuse and addiction disorders. So, you know, just trying to do our best to prevent some of that.
But it's so important to do that, because so often in the prevention field, well, number one, we always say this, so we never get to see the fruits of our labor, because prevention is a long-term process, and we're planting seeds. We don't see the flowers, even the trees, for years. And if we're fortunate enough to still have contact with the people we worked with, we get to see some amazing things. We get to see miracles happen. But, you know, these are hard times, and we're always behind the 8 ball in prevention anyway, because funding tends to lag 3 to 5 years behind. That's my 3 to 5 years where that coalition thing comes from. Funding tends to be, you know, like 5 years behind what's going on. You get funded for a specific problem or drug prevention. 3 years later, you're into your 5-year funding cycle. Everything's changed. The whole landscape's changed. Now, what do you do? But your funding is specifically to do this plan. So that's one of the challenges we face in prevention. And something I've always said is, it's not just about the drugs. We need to look at really what's going on with people and why they use. And if we don't address those factors, we're just going to have very temporary change. And if we want lasting change, it comes by changing the system, by changing the way people are taken care of, by changing how we teach them to cope. But if you can't put food on the table, you don't have a roof over your head, or you're worried about your job, how can you even put your time into looking at you know, prevention? Those factors need to be in place in order for prevention to succeed. You know, it's hard. If somebody's on the street and they, you know, maybe they abstained for a while, who's to tell them now that they have to make sure that they follow the same things that they did before, the same plan? Or if you've got a lot more tension in your life, hopefully you've got coping skills, but what if you don't? So we need to look at this systemically. I believe that this whole pandemic does have, you know, a silver lining there, that we get to look at all of this, and maybe we get to make some of the changes with all the social unrest. It's not just because of now. It's for the last 400 years. We're starting to look at it now. People are starting to really come together now. Let's utilize that. Let's take advantage of this, because we've got a chance here to travel down new roads. And if we don't take that chance, I don't know where we're going to be headed.
Great point. It's a great chance to travel down a new road in many ways.
Yeah. Well, speaking of traveling, this has been so good. The time has flown by, but I always like to end the podcast with a fun question. And it's usually the same one. So I'm going to ask you, what did you want to be when you were growing up?
I wanted to be a designer.
Nice.
You wanted to be the rapper?
A designer.
I'm joking.
I used to rap in my teenage years. It was actually pretty funny. And I do it every once in a while for a friend's birthday. I'll do like a rap site amongst girls. And I do it with my nieces. They're 9 and 10. And I'm like, since I've been doing it since they were like 5, I'm like, let's do a rap site. So they say like, my name is Emily and I was having a good day. And then I got homework. And then we just keep going. And it's like a way to bond.
Are you going to give us a sample?
But drop some bars. Yeah, rapping was a part of my past life also, and I used to design clothes myself too. I had a clothing line at one point in my life. So wow. Yeah.
That's awesome.
Like you guys are twins and you didn't know it.
Exactly.
Yeah, well, I wanted to be a veterinarian, but I wasn't very good at science. So then I decided I'd be a famous musician. And I've had my 15 minutes. That's been about it. But, you know, I used to want to be a social worker. So I kind of stayed in the social services, and I was an English teacher for a while. But I mean, I haven't given up yet. I'm never going to be a vet, but I still might become famous. So
you will become famous.
I think that can happen.
I mean, you're actually already famous. Like I told you, when like you're a rock star, dude. I walk in the room, you know, Ronnie Katz.
Yeah, in very small circles.
Listen, man, like you're a rock star, man. Someone even said she's a rock star. I'm like, I know. I keep telling her that she won't listen to me.
That's good. My ego needs that. It's okay. You can keep reading. Well, thank you so much for joining us today. This was so great to talk to you.
Thank you, guys. Thank you for having me on the show. I really appreciate it.
Yeah, hopefully you'll come back.
Yeah, let me know.
Talk to us. Yeah, I mean, you just provide so much really great information to people today.
Okay, thank you. I appreciate you saying that.
Okay, I know we'll see you soon.
Yes.
All right, have a good day. Take
Bye.
care. All right, well, the sun's still shining, Chevar.
Yeah, the sun is still shining.
It's a good day.
It is a good day. It's the weekend. It's Friday.
I know. Well, when people hear this, hopefully, well, usually we do release our episodes on Friday, so that'll be relevant. I mean, we've had a pretty busy news cycle this week with the debate.
Yeah.
We got news that was reported that the
president.
That's your old saying that, you know that. The occupant of the White House and the First Lady tested positive for COVID, supposedly. So that should be interesting to see how that plays out.
Mm-hmm.
It's been an interesting news cycle.
Very interesting. Well, maybe come Monday, we'll have different news.
Yeah, I'm at the point right now, I'm just sitting back watching the universe unravel.
Yeah.
And not in a bad way, just the universe play it out. I'll put it, not even unravel, just I'm watching the universe play things out.
I agree with you. The universe is trying something new and testing us and seeing how we navigate through it. And like I said, come Monday, come a few weeks, come a few months, we hopefully we come out better than we were prior to what the universe is doing.
Yeah, we don't know where it's taking us either, but all I can do is work on me.
Absolutely.
And keep the inner voice and the inner strength fed. And like, Marinez was talking about, taking time to soothe yourself, nurture yourself.
Self-care.
Because no matter what happens in any direction, that's the piece I own.
Absolutely.
And I need to do that. But for now, I'm going to say, pass the popcorn.
That said the same thing this morning when I got that news. I'm going to leave it to your interpretation, whoever's listening.
Well, it's always great to do this. We didn't do it for a couple of weeks. I missed it. So have a really great weekend. Get some rest. And I'll be back to do it again. Thank you for joining us once again on The Solution. Nothing changes if we change nothing. Let's watch this world roll by and see how we can change it. But change starts with one person, and that's me. So I hope you think about ways that you can change yourself to make this world a better place. Have a good one.
Bye-bye.